Hi, Mr. Stillman. I'm Morgan. I'm going to be your student nurse today. Can I go ahead and begin by just getting your name and date of birth, please? Okay, and that matches your bracelet here. Do you have any other allergies besides the Tylenol with codeine I saw on your chart? No? Okay, are you having any pain right now? No? Okay. So today I'm going to be doing a piggyback IV infusion. So I'm going to be giving you your normal saline, and then you have an antibiotic, metronidazole, which is for your H. pylori infection. I already checked the MAR and made sure it was the right medication, right dose, right time, right patient, right route, all that kind of stuff. And it was already checked your name, date of birth. And then also I checked for its compatibility. So now I'm going to check the IV site here for any erythema or swelling or infection, and that all looks good. And so now I'm going to begin getting the infusion ready. So we're going to start with the normal saline first. And then with each of these tubings, I'm going to be labeling it with the date, all of that, just to ensure that the tubings change at the proper time intervals. And this will be kept sterile, so I won't be touching the end of it. And the push and twist. And I'm going to make sure that it's clamped, which it is. And then I'm going to be priming it. Normally I would be doing it over a sink, but right now we're just doing it over this bowl here. I'm going to turn it, and then I'm going to unclamp it and watch for the bubbles to run out. So unclamp, and it's flowing there, and I'm watching the air bubbles come through, and then I'm going to reclamp. And then at this point I would swab this end and then swab the port and put it on. And so now I'm going to just hang this one, and like I said, I would be labeling these tubings. I'm going to make sure the drip chamber is about half full so I can watch the drip. Now I'm going to put this in here again, and it is already clamped for now, so I'm going to open this and put this up, close that. Okay, and then I'll turn it on. Turn it on there. You doing okay, Bob? Still no pain? Okay.
All right, looks like we are all done, Bob. How are you feeling?
So I'm going to do channel select.
Awesome.
And then the first one I'm giving you is your 0.9 normal saline. So I press that one. It is correct, yes. And then once again, what I'm looking at here, I'm looking at the proper rate. So that will be 100 milliliters per hour. And then I'll put this at 9:50, and so I can come back before the buzzer starts going off at you. And then I'm going to hit start, and then I'm going to unclamp it. Should be green, and I should be seeing a drip there. There we go, there's the drip. Okay, Bob, now I'm going to get going on your antibiotics. So for this one, we'll be connecting the ports, so we're going to be needing an alcohol swab. So I'll just leave that there for a second. And then I'm going to get this clamp out because we're going to be hanging this one lower. So for now, I'm just going to put this here. I'm going to make sure this one is clamped as well before I put it in, which it is. I'm taking this one out.
Before I started it again. No allergies. Okay. No.
Once again, making sure not to touch that.
Make sure the bed is lower.
And it is clamped.
Lower the bed, and make sure the two upper side rails are up. Alright, do you have any questions
Okay.
for me? You're still doing okay?
So I'm going to be
Alright, great.
swabbing this port here.
I don't know why it's so slow.
And then I'm also going to be swabbing this port. Okay. And being careful not to touch those. Connect them. And then here I need to prime my tubing again, so this time I'm gonna do some back priming. So I'm gonna hold it up, and I'm going to unclamp this one, and I see it running through there. Bubbles are all out, so I'm gonna clamp it again, and since there's excess in the tube, I'm gonna squeeze it over, make sure it's about half full again, just so I'm able to see the drip. And so now I'm going to this one, hang this one higher, and then I'm gonna hang this one down here. Okay, and then that one's unclamped, and this one I won't clamp in a second here. So now I'm gonna do channel select, secondary, and this is your metronidazole, so that is for your H. pylori infection. Okay, sorry there, I pressed the wrong button. So I'm in metronidazole, and then the 500 milligrams per 500 milliliters, and I'm checking to make sure that's the right rate. And then it's asking me again, and yes, I am sure. And then checking it one more time, and then next, and then start. And then I'm going to be unclamping this one. And then I'm watching for a drip, and then there is a drip. And then, like I said, I would label the tubing with the date. I'd be checking to make sure he's doing okay. You doing okay, Bob? Yep. And then now I would be checking to make sure the railings were locked and the bed was locked and that the bed was in the lowest position.